Slide 1. Appropriate interdisciplinary interventions for hereditary, genetic, and endemic diseases and high risk health behavior within the African American culture. Current mortality disparities amongst African American culture include cancer, diabetes, and infant mortality, as well as cardiovascular disease. Some morbidities include obesity, hypertension, mental illness, and stroke. Poverty and lack of education, along with persistent racial and ethnic discrimination, significantly negatively contribute to the health disparities in the African American community. Healthcare providers and the interdisciplinary team members can decrease these disparities to improve those hereditary, genetic, and other diseases and improve health behaviors. Now, the way we improve these health behaviors is encouraging a trusting relationship with our patients through open communication and also encouraging that patient to ask questions because no question is dumb. The only dumb question is one I ask, right? And then informing our patients of the impacts of their unhealthy lifestyles so they understand the damaging effects. Also, implementing community socioeconomic action plans that consist of health literacy, coordinating transportation, and assisting with housing in order to promote optimal healthcare outcomes. Also creating also creating community health centers in close proximity to predominantly African American communities, encouraging regular and follow-up visits with our primary care providers, setting up a system to help African American patients remember to take all medications as ordered so those disease processes are being managed optimally, promoting health programs in the community, educating patients regarding the best healthcare practices, collaborating with that primary care physician and other members of the patient's interdisciplinary team for a comprehensive approach, and then regularly scheduling interdisciplinary meetings to discuss plans and ways to decrease gaps and barriers in healthcare amongst African Americans. Also, here we have listed some graphs from the Centers of Disease Control and Prevention, just showing how significant high blood pressure, diabetes, and stroke is in the African American community in comparison to their white counterparts. Also, it does show life expectancies here at the bottom. And then they do have a quote here saying that African Americans are more likely to die at early ages from all causes.